name's Frances Duffy, and I'm a consultant clinical psychologist working with older people in the Northern Health and Social Care Trust in Northern Ireland. And I developed Clear Dementia Care. Today I'm going to be talking about PEACE, which is a whole system approach to understanding dementia and reducing distress. This work's been supported by the Northern Health and Social Care Trust, the Health and Social Care Board, the Executive Office and the Department of Health in Northern Ireland. A person with dementia interacts with a variety of people across a variety of services, throughout the days and weeks. And as a consequence of this, it's really important that everybody has an understanding of dementia and how to support and respond to a person with dementia. And what we know is that sometimes a person with dementia's behaviour can change. And this is usually whenever their needs aren't met or they're experiencing confusion about where they are. And if we have an understanding of this, then we can better offer support. Because what we know is that sometimes carers report that they can't understand a behaviour or they can no longer cope with the behaviour. And this can lead to significant stress for the person and also for their carers. The overarching framework we use is PEACE to help us understand distress. And if the needs are met, the person with dementia doesn't experience distress as they engage with the world. And if we understand the person's unique life history and support them to be as independent as possible, we can reduce distress. So our goal really here is prevention. And we developed the Clear Dementia Care app to help carers, care staff, and professional staff to understand dementia and how best to respond. So the app then, the goal of that is to prevent distress. But what we know is sometimes that prevention doesn't always work. And a person might experience an event that impacts on their physical or psychological well-being. And this increases their distress. And if we engage in early intervention, though, we can reduce that distress. And there's lots of tips and advice in the app to help engage in early intervention. But what we can also offer is we can offer training to carers and care staff. So we've a range of training programs that provide a bit more information about dementia and how best to respond. And if early intervention doesn't work sometimes, it's if the behaviour is more complex. Then if this happens, then we may need to assess why that behaviour is happening, develop a care plan to help the person to meet their needs, and then evaluate the impact of that care plan. And we do this through our bespoke Clear Dementia Care. So we offer training to carers and care staff to help them implement a more comprehensive Clear Dementia Care. And if we don't do this, there's a risk then of restrictive interventions. So there's a risk of that the person may be prescribed unhelpful medications or other practices that restrict the person. So our overarching framework then, PEACE, is the goal is prevention, early intervention, and if that's not possible, then an assessment of what might be happening and why, development of a care plan, and then the evaluation of that care plan and making adjustments then as appropriate. And the goal here is to avoid restrictive interventions. So this is our Clear Dementia Care app. It provides information to help you understand dementia, seeing the perspective of the person, seeing the whole person, and the ability to chart behaviours across the day and week to identify any patterns in when behaviours present. And then also lots of examples of different behaviours, why they might be happening, and how best to respond. The app's been downloaded in 178 countries with extremely positive feedback from carers, care staff, volunteer organisations and clinical staff. And care homes have advised that they're actually using the app as part of their induction for new staff, and other countries are exploring translation. Clear offers an accessible and humane approach to help support a person with dementia, and anyone caring for someone with changes in behaviour will find the app packed with practical tips and advice. Every client is unique, but this app really helps to give an understanding and insight to what a family can expect to be dealing with and how best to consider the needs of the dementia patient. The app keeps it simple and makes things simple to understand. We've produced 2 books that we offer free to care homes supporting people living with dementia in care homes, and also carers of people living at home. And these books contain around 100 illustrations each that show helpful and unhelpful responses from the perspective of the person with dementia. some feedback. It hit the nail on the head in lots of ways and is really easy to dip in and out of, as well as being a good reminder to think about the perspective of the person with dementia. So just to give an example of some of the illustrations, an unhelpful response, supporting with personal care. So we've got a lady who's lying in bed. The care assistant comes in, hello, Barbara. And Barbara's thinking, who's she? What's she doing? She's frightened. She doesn't know who this person is. But Barbara's resisted support for the last couple of weeks. So this care assistant's going in thinking, what mood will she be in today? Will she accept support? Will she resist? She starts to offer support. Let's get you dressed, Barbara. And Barbara's thinking, what's she doing to me? And also it's cold, because even though the room might be warm, whenever you remove the duvet, that change in temperature can cause it to be cold. Barbara now is frightened. And so what she does, she takes her arm, she tries to stop the care assistant from supporting her. And the care assistant saying, don't do that, Barbara, you're hurting me. And she's thinking, I need help here. And Barbara's thinking, no, get away from me, don't touch me, because she's frightened and doesn't know what's happening, doesn't know what the intentions of the member of staff are. So another member of staff comes in to help. What's wrong, Barbara? And the other care assistant's thinking, why is she so aggressive? And Barbara's thinking, who are they? Now I have 2 people in my room, and she's worried that she's potentially being assaulted. So her stress levels escalate, and she starts to shout, get off me, get out of here. And he says, we're just trying to get you dressed, Barbara. And he's thinking, what's her problem? Why will she not let us support her? So we've got one situation, we've got 2 different perspectives. We've got the perspective of Barbara, who's frightened and doesn't know what's going on. And we've got the care staff who want to support her, but they don't understand that she's frightened. So we think about a more helpful response. Barbara's sleeping. The care assistant comes in, and this time she pulls the curtains to orient Barbara that it's morning time. Good morning, Barbara. Barbara's still thinking, who's she and what's she doing? But this time the care assistant sits down. Hello, Barbara. I'm Lisa, a care assistant. How are you today? Now, Barbara doesn't hear everything and understand everything she says, but she's Lisa. But Lisa's sitting down now at her level, so she doesn't feel intimidated. So if someone's standing above us in the bed, it can feel very intimidating if we're lying down. So this is trying to convey to Barbara that I'm a safe person. And by slowing down the pace, I'm trying to help you to feel safe. And then after a few minutes, she holds out her hand. Shall I help you get dressed? It's an invitation. It's nearly time for breakfast. And Barbara's thinking, I'm hungry, I better get up. So we've helped her to feel safe and reduced her distress. We offer a range of training programs for carers and care staff, for staff working with people with dementia, for staff who are going to use the model to assess behaviour and develop the interventions. And then we've the train the trainer for staff who want to deliver clear dementia care training throughout their organisation. And our training is supported by the app, by illustrations, by animations, and a range of other resources. And that includes a handbook to support implementation with case examples, and a suite of resources to support implementation of the model. This is feedback from some care staff. This is from 992 care staff and care homes, and we asked them to rate their understanding of behaviour before the training and after. And you'll see there's a significant increase in their self-rated good or very good understanding of behaviour. We've since trained over 1,500 care home staff and 500 staff in other voluntary and organisations and NHS trusts. And we're just writing this data up for publication. Feedback from training. For the first time, I seen dementia in a new light. Not once was I bored. Not once did I not want to be there. Not once did I think I had nothing more to learn. So many times we're so busy responding to the illness of dementia, we forget that behind that illness is someone who just needs someone to say and show that they have a purpose still and are still valued. I left with a better understanding of my role as a carer, a better understanding of the person behind dementia, and realised that good training is at the heart of quality dementia care. I'm a better carer because I'm not looking at dementia. I'm looking at someone very special who deserves the best I can give. Our outcomes from clear dementia care: clinical efficiency, over 50% reduction in face-to-face contacts and the length of clinical episode. Waiting times have reduced. In the first year of implementation in the community alone, the cost savings were 100,000. We've had reduced hospital admissions, and we're calculating the cost savings of that. We've increased clinical effectiveness with reduced distress and improved quality of life for the person with dementia. So the Clear Dementia Care app is free to download from the App Store or Google Play. So we'd encourage you to please download and share with friends and colleagues who may find it helpful. So that's the end of my presentation. I'd be very happy to address any questions if people want to contact me via email or via Twitter. And we have a number of resources on our Trust website that you're feel free to check out the website and have a look at some of the resources. So thank you very much for your attention.